Why use BPC157? How can I use it with my patients? And why is it best to use with iontophoresis patch? Well, number one, BPC157 is kind of known as the Wolverine peptide. It's a naturally occurring peptide we have in our bodies already. But what they found with research is BPC157, when you either inject it or apply it with iontophoresis to an area of injury, it helps the area heal in about half the time, which is crazy. And it's not an anti-inflammatory, so it's not like you're putting a pain medication on and you're masking something. You're literally helping your body and your own stem cells heal much quicker, which is amazing. And that's why it kind of fits in that regenerative medicine area. Now, as I had mentioned, BPC157, we know it's very effective. There's, just Google BPC157 and healing. It helps ligaments heal, bones heal, muscle tears, post-surgery, anything you want to heal quicker. BPC157 can cut that time almost in half. So it's just this amazing thing. Then you have to decide, well, how am I going to get it? Well, it is available via injection, but due to the short half-life, BPC157's half-life is about 30 minutes. So what that would basically mean is a typical injection of BPC157 dosage would be 300 micrograms. That means if you inject yourself, we'll say you have back pain in your back, and with 300 micrograms, within 30 minutes, you only get the dose effect of 150 micrograms. And then after another 30 minutes, you're getting the dose effect of 75 micrograms. As you can see, every 30 minutes, you lose that dose effect. So that's why if you're injecting it, you really should be injecting 4 times a day, at least, to get a good benefit. With the patch, it works much differently. With the patch, you're going to get, the patches come with 1,000 micrograms, which is a larger dose, but it's spread out over 12 to 14 hours. That's how long the patches last. So instead of sticking yourself with a needle, 4 or 5 times a day, you simply take the patch, you put the molecule on there, apply it to the area, and just wear it. You don't feel it. It's comfortable. It's pretty much self-contained. So a much more effective way to treat an area. And I had also mentioned before, you can take and buy BPC157 orally, but the problem with that is twofold. Number one, you lose about half the strength going through the GI tract, so you'd have to double the dose. So now you're talking about you'd need at least 600 micrograms, and remember the half-life is that short 30-minute window. So, really you're going to have to take 600 micrograms 4 or 5 times a day to get the same dose effect, which gets very pricey. So by using the push patch for BPC157 to heal any type of injury, it's going to be much more convenient, and it's going to save you a bunch of money.